sarcoptic mange. Most commonly observed mange in case of the sheep and goat. So it is caused due to the Sarcoptes scabiei organism, which is having 0.4 to 0.6 millimeter diameter. It is a burrowing mite. It is a penetrate into the epidermis layer of the skin and it feeds on the serum or tissue fluid or this hair follicle. And it is having very contagious nature. Once one animal it is affected, frequently or within short period, more animal it is affected. And it is having acute type of nature. And important sign it is intense pruritus. Once animal they are having sarcoptic type of mange, there is a continuous itching we can found. And most important, it is having the zoonotic appearance. Or whenever this sheep and goat we handle, veterinarian or this animal owner, goat owner, or any persons who are handling such type of affected animal. So at that time, there are some papules or reddish pustules we can see on the arm or exposed body part of the animal. On the neck or on the chest or on the hand, we can see the such type of lesions, and these lesions are very much irritating one. So erythematous papular lesions, it observed due to the handling of such type of animal. So in macroscopic examination, whenever we go for the deep skin scraping examination, so at that time we can see such type of mite. And these are the typical lesions. So the sarcoptic mange, in this mainly head and ear of the animal, they are mostly affected one. So no doubt, whole body it can be affected, but most of the lesions we found on the head, neck and abdomen, on the thigh of the animal. Just we can see on the face on the animal or generalized type of lesions, sometimes it occur because in case of sarcoptic mange, there is a continuous itching it is there. And due to the continuous itching, there is a bleeding tendency on the skin or erythema it will occur. And there is a rapid spread of lesion on the whole body it is there. And in that case, there is a secondary bacterial infection chances are more one. And in case of sarcoptic mange, scaly type of lesion, wrinkling of the skin we can found. Due to the constant itching, there is a oozing of serum or fluid from the body of the animal it is there. So there is a thick crust. So whatever the papules and pustules are there, it is converted into the crust form. So crusty type of lesion. In this photograph, you can see due to the secondary bacterial infection, there is a scar formation, crusty type of lesion, or it is called as hyperkeratosis. There is a increase in the thickness of the skin of animal due to the secondary bacterial infection. And due to that, there is rapid loss of body weight of animal. In milking animal, there is a decreased milk production, damage to the skin or head it is there, and there is a secondary bacterial infection or pyoderma we can frequently found. There are some diseases we can differentiate from the sarcoptic mange. So first is sarcoptic mange, zinc responsive dermatitis, insect hypersensitivity and atopic dermatitis. So in field condition, so many times there are no facility of laboratory examination it is there, and there are limitations are there. So at that time, on the basis of only physical examination and categorization of the skin lesion, we can easily differentiate the mange infestation. So zinc deficiency. So in zinc deficiency, there is a symmetrical erythema, it will there. So there is a reddish discoloration of the skin, and this whatever the crust and scale formation it is there. So we can found around the eyes. So there is a thick raised type of lesions we can found around the eyes of animal, or sometimes lesions they are present on the face, ear pinna, mucocutaneous junction, or pressure points, elbow or half joints they are also affected one. And pruritus, in case of this nutritional deficiency, generally it is absent one. And once it is invaded with the secondary bacteria, pruritus it may be intense one. So according to the invasion of bacteria, itching we can found. Here we can clear cut see. In case of sarcoptic mange lesions, they are very shallow type of lesion. While in case of zinc deficiency, there is a crusty, grayish, raised type of lesions are there. And generally, periphery of the skin, it is generally affected one. So in this photo, we can see the tip of the ear, it is affected. So here we can see tip of the ear or periocular alopecia, it can be also occur, or at the distal part of the body, skin lesions we can observe. So whenever such type of lesions we observe, so at that time, such animal, it should be treated with the chelated mineral mixture and this combination of the multi-minerals. Or we can go for the injection of multi-mineral injection. And dose rate, it is 2 ml intramuscular and it is given weekly. Once in a week it is given, and near about 4 to 6 doses. It is for 1.5 month therapy it is required at weekly interval along with the supplementation of the chelated mineral mixture. Such cases they are required very well. Or locally we can apply zinc oxide or glycerin ointment. So 2% ointment we can apply locally for the early recovery. Then second differential disease, it is insect hypersensitivity. So in case of sarcoptic mange lesions, they occur on the whole body or at the ear pinna or face region. While in case of insect bite hypersensitivity, most of the time lesions they are only occurring on the dorsal abdomen, dorsal aspect of the abdomen. And these lesions, it is due to the hypersensitivity reaction due to the bite of insect like culicoids. So when this culicoid bite, it will occur when the animals they are grazing at the field condition. So at that time, animals they are having such itching type of lesions and lesions on the upper portion or dorsal abdomen we can see. So typically, restriction of lesion to the dorsal abdomen, it is a clear-cut symptom of the insect bite hypersensitivity. So in that case, we can go for the injection antihistaminic for a period of 3 to 5 days. This condition it can be recovered very easily. We can give number of options for the treatment in case of the mange. So we can go for the cypermethrin or permethrin at the dose rate of 4 ml per liter. So any preparations which are available in the market, which is containing permethrin or cypermethrin, it can be given at an interval of 7 to 10 days. Or these lime sulfur dips. So it is very approved type of treatment in case of the treatment of the mange. So this hot sulfur lime dip 2 to 4% it is given continuously for a period of 5 days, and after that it can be given weekly. So weekly treatment it is necessary, but at the start of the treatment when there are more severe lesions are there, we can go for the sulfur dip or sulfur spray for a period of continuous 5 days, and after that you can continue at the weekly interval for a period of 3 to 4 doses are necessary. Or we can go for the injection ivermectin or doramectin. So whatever the preparations which are available in the market, so it can be given at the dose rate of 200 microgram per kg body weight or 0.2 milligram per kg body weight subcutaneous at the weekly interval it is given. Again, it requires 3 to 4 weeks doses. But sometime there due to the frequent use of this ivermectin or doramectin, there is a resistance it can be occur. So for that purpose, we can go for the alternative therapy with the neem oil and currants oil. So locally we can apply this oil and it will give very good result. Or simply whatever the available material are there. So aloe vera paste. So just you have to clean one aloe vera plant part and you have to make the paste, and that paste it will also act as an anti-inflammatory and this acaricidal action. Or simply povidone iodine 1 to 2% it can be given. And in case of the secondary bacterial infection, like in case of sarcoptic or demodectic mange, we can go for the broad spectrum antibiotics like endofloxacin, ciprofloxacin, or tetracycline we can give for a period of 3 to 5 months. And most important, separation of animal from other animal. So in case of mange, it is very contagious nature type of disease. So you have to isolate the affected animal and you have to go for the treatment of such affected animal. So most of the time when the mange it is there, we are only concentrating on the affected animal. But what about the environment? Because in environment, disinfection, it is also important one. So spraying of the shades and in and around area, the chlorhexidine or sodium hypochlorite, it is very essential for the removal of this mange. So thank you one and all.